All right, so this is going to be a review of the Comlex Level 2 PE and little things that I kind of noticed and how I like to take it. A few things I wanted to mention is that there is no mouse when you actually take the exam. The only way you can scroll between the S, the O, the A, and the P is actually by hitting the tab button, and you have to use the actual arrows found usually on the bottom right of the keyboard to actually go in between sentences within the actual boxes. The keyboards, I was a little worried that they're going to be kind of like the old 90s style keyboards with the huge individual buttons, but they're actually kind of small, not quite like the chiclet style, but kind of in between, and they weren't too bad to type on. For actual reviewing, I just read the JB Comlex Level 2 PE Review Guide. This is just some printouts of in the actual book. The first few chapters kind of is their approach of how to do it. And then in their Appendix A, they actually have a review of everything they kind of talk about. And what I would recommend is printing out these 3 pages and then just make notes of things that you like or things that you want to do when you go in. So here's kind of just those review sheets, and I think it's a phenomenal way, and it's kind of what I used when I did it. So what I'd recommend if I was going to do it all over again, I would 2 to 3 weeks prior, I would get the JB review. I would read those first few chapters, and then I would do, and I actually did this, I did, because there's like 60 cases in there, I did 2 to 3 cases every day, and I went on the NBOME webpage, I grabbed the SOAP, went to the SOAP practice page, and my wife would pretend to be the patient, and then I would go through the case, and we would time it all out, and then I would type it up on this practice page, and it really got me ready for the actual day, and on the day of the test it was actually easy. So this is kind of their format. I know a lot of people, they just knock on the door and they go right in after they read the name, age, chief complaint, and the vitals. For me, I would actually write all this down. For the most part, a few things in there obviously are I wrote down some treatments and diagnosis already. So I've already pre-populated a little bit. So anyway, so this is what I do. I write down the name. I write down the first and last name. And so when I go in there and I ask them what they want to be called, I can circle John or I can circle Smith. And so I know they want to be called Mr. Smith because I circled it. I write down CC for chief complaint. We use the Colderaz mnemonic at our school. Whatever one you use, I think there's the PQRST or whatever. I always write that mnemonic down. And then you're trying to save time, because it takes me a little over a minute to write all this down. So I don't write like PMH for past medical history. I just write M for medical history. I just write S for surgical history. I write F for family history. I write meds for what medications are on, allergies, and then I write reaction because I'm pretty bad at actually remembering to ask what the reaction is to penicillin or whatever. I really like this mnemonic that JB uses. It's just fed tacos, and I always remember the first part has to do with kind of their health. What they do for feeding themselves, what kind of food do they eat, E for exercise. Then these are kind of your drugs here: drugs, tobacco, alcohol, caffeine, and then occupation, and then this is their sexual status, or just their status, I guess. Are they married, single, whatever. And this is something I added. I wrote stop. S is for summarize, so I like to just go back. Oh, what was the pain like? When did it be? So you said that it's a sharp pain that began 2 days ago. That's located in your back. That's constant. That's worse when you stand up. Better after you take medications and you have a fever associated with it, and it's a 6 out of 10. And then they go, oh yeah, that's it. Or they'd say, oh, well, actually, no, this, whatever. Then the P stands for physical exam. And I move on to the physical exam. Now here's V, that's for my vitals. And I will write down if something is out. So if they have high blood pressure, I will write down high blood pressure. And so automatically that will do something for me instantly. Now I have a diagnosis and I have a treatment. And I'll get to that in a second. But I only write down those that are out of sync because you're going to be able to go back to those. Those sheets are available to you. You can bring them into the room. So remember that you have their name, age, chief complaint, and vitals with you at all times. So don't worry about that. I have H for HENT, which I may or not do. And now, something I didn't mention is on this physical exam, I will actually write out what I want to do off the chief complaint. So if I see rash, I'm going to write down heart and lungs, heart, L for lungs, and then I'll write down skin, or endocrine, something that's going to, make me think of what I want to do. If they come in with a cough, I'm going to write down heart, lungs, HENT. So I am not doing every system of the body, just what is based off the chief complaint. And so I know that it needs to be done. And I always write OMM in there because I want to have a place to put it. Speaking of OMM, if you're concerned about what patients you'll be doing OMM on, I wouldn't worry about it. Basically, you'll go in and the chief complaint will be like their leg hurts or something. You're going to walk in and they're going to say something like, oh, my leg hurts, but I was curious, my brother, he had some doctor move their leg around and they felt better. Do you do anything like that? So you're going to know within the first 20, 30 seconds whether or not you're going to be doing OMM on them. You don't have to sit there and think, should I do it on this person or not? The 3 or 4 patients you get that you'll do OMM on, it's not going to be a big deal. Diagnosis, I write OMM again, and all your diagnoses are going to be the same. Somatic dysfunction of, you're not going to write like T3, T4, you're going to write of thoracic or, of cervical vertebrae or of neck or of whatever. It's going to be a region of the body. So that's your diagnosis. You're not going to get specific with it. Primary diagnosis, this is going to be what they're there for. So if they're for a cough and you think it's bronchitis, you think that it's pharyngitis, you think that it's whatever, you're going to write those and you're going to write them in the order that you think it should be. So as I'm question up here, I'm writing down diagnosis down there. I'm writing down, oh, I think this might be pharyngitis. I think this might be whatever. And so over here, I might even be writing rapid strep down while they're up here, while they're telling me their story. So I'll get all their primary diagnosis down, and then your free points come from these secondary diagnoses. So for example, remember we said this person might have high blood pressure. Now I'm going to write down hypertension. And over here, I'm going to write down recheck. I never rechecked vitals, but I always wrote down to recheck vitals. And so that's, and then keep blood pressure log, so you get points for all of that, and you'll miss them if you don't get those down. So another thing also, if you don't think they have cancer, but there's a possibility, right, rule out cancer, right, doubt, TB, right, write all that stuff. So if you think it's something, just write it. If you don't think it's something, write doubt. If you just, you have to rule it out, you write rule out. Then to treatment, use the mother mnemonic medications. What are you going to give them? Yeah, you don't need to write down dosage. OMM, this is where you get specific. What did you do? I did muscle energy. I did myofascial release. What did you do the muscle energy on? I did it on, third rib or whatever, T3, whatever. What I did myofascial release of, you have to name that part of the body. So you need to actually write down what it is. Obviously, you're not doing HVLA. I wouldn't do counter strain because that takes 90 seconds. Muscle energy doesn't take very long. Myofascial release, you just hold until you feel the release. You just put it in that position, and then whether you say it released or not, you just say, whether it does release or not, you just say it released after 10 seconds, and then you move on, and don't forget to reassess. T is for tests, imaging, your rapid strep, whatever you're going to do. This is your holistic approach. You need to, RICE, rest, ice, compress, elevate. Are they going to get a work note? Are they going to get, a school note? Whatever they need outside of a pure medicine. This is a referral. You're going to send them to the cardiologist. You're going to send them to the endocrinologist, physical therapy, occupational therapy, and then return. When they come back in 2 days, a week, a month, whatever. You need to have all of those down. So basically, once you get that knock on the door, you hurry and just write all this out, and then you just look down and you fill it out. And then when you write a note, you just fill in everything that you wrote down. It's really not that difficult. Get the Comlex, the JB Comlex review, read it, do a couple cases, and you're going to be okay.